COVID-19 virus. And on behalf of myself, my team, all of us here in the city, I send my deepest condolences to the individual's family, to their friends, and to all of their loved ones. This should be a wake-up call for all of us, particularly anyone who may still question whether or not this is a real thing, anyone who questions the gravity of this issue. We know COVID-19 is very, very serious, and it can be deadly. It doesn't care how long you've been infected, how you got it, or where you've been. It doesn't care if you're black or brown, rich or poor, how much money you have, or where you live. Combating the spread of the COVID-19 virus is the St. Louis region's shared responsibility. We have to all recognize that our individual actions or inactions can have grave consequences on the health and safety of ourselves, of our family, and of those who are around us. So that's why you continue to hear me say, please stay home if you possibly can. Venture out for essential needs only. Help us slow the spread of the COVID-19 virus. You know that tonight at 6 o'clock is when the stay-at-home order goes into effect. So please, stay home. If you have to go out for essential needs, food, doctor's appointments, medicine, stay 6 feet apart. Wash your hands. For goodness sake, if you are sick, don't go anywhere. On Saturday, Dr. Eccles issued this stay-at-home order, and as I just mentioned, it does go into effect at 6 p.m. tonight. We are getting lots of calls, emails, into this office, into the health department office, people asking, can I do this? Can I do that? Can this business stay open? Can that business stay open? That's very encouraging to me because people want to do the right thing. It's very encouraging to me that everybody wants clarity on what they can and can't do. And I'll just say this very, very simply, that in the order that came out, the intent of this order is to ensure the maximum number of people stay at home to slow the spread of COVID-19. All provisions of this order should be interpreted to effectuate that goal. So there are questions. I'm encouraged that people are trying to get their answers, and the announcement today is just further evidence that this is a very serious situation and we all need to take heed. I'm going to ask Dr. Eccles to really talk about this particular situation to the extent that we can talk about it. Thank you all for being here and for helping us put this message out. Dr. Eccles?
Thank you, Mayor. As you mentioned, we stand here with heavy hearts because COVID-19 has caused a death in the city of St. Louis. As we all know, there's been rumors and myths circulating in the community. One of those myths is that young people can't get it. So this case is evidence that young people can get it and that it can cause death. And so the measures that we continue to recommend every day, staying at home if you're ill, covering your mouth if you cough, washing your hands with soap and water regularly are really important, and they should be adhered to, not only to protect yourself, but to protect your families, your friends, and the community at large. The individual was in their 30s. Again, someone that's very young, and which is cause for concern for us, especially if individuals are not adhering to the guidelines and the recommendations that have been issued before. So again, we urge everyone in the city of St. Louis, everyone in the St. Louis region to really adhere to those social distancing and preventive measures, recommendations that we continue to issue day in and day out, because this is a serious matter and no one is exempt from getting COVID-19. Anyone that's exposed can become infected. So we're asking you to protect yourself, again, not only for yourself, but for your families, your friends, and for the community at large. Thank you.
Question for the mayor, Dr. What can you tell us about where this person may have traveled, what risks she may have had, anything about when she was diagnosed, how long she was hospitalized, and tell us story.
So what we can say is that it's not travel associated. Exactly where the exposure occurred, we don't know. We're still gaining information, working with the individual's family to obtain that information, but we can tell you that it's not associated with travel. Again, that also leads to our point that we've kind of emphasized over the last few days as well, that we have evidence of community spread in the St. Louis region.
Has she been hospitalized for some time before the test?
To our knowledge, only recently.
What part of the city is she from?
That I don't know. I don't have the specifics on that, so I can't give you that information.
When did she test positive?
Actually, yesterday.
Yes, I have a question. Mayor, what actions are you, certainly our thoughts and prayers go out to this family, first of all. What actions are you taking in city government to either reduce the number of employees working in the building, shut down departments? Do you have steps being taken so that obviously City Hall is in step with the direction?
Absolutely. So we have spoken numerous times with every department head. We have to maintain essential services: police, fire, corrections, any water main break, trash pickup. We have to continue to do that because that's for public safety also. But most departments probably have half or fewer of their employees at work today, and it goes into effect this evening. So we are taking steps in every department to maintain the most important services that people really have to have, but to cut down everybody else and send everybody else home and say to them, please stay at home.
And one more question in relation to the victim. How long has she been diagnosed with coronavirus? And has she been hospitalized? I mean, was it like her
I think, as Dr. Eccles said, she had been very recently diagnosed, I think tested positive yesterday, he just said, and had been hospitalized for a little while and just died recently.
Can you tell us anything about the person's occupation, what they did?
I really cannot. It's just personal information that I would not want to disclose and not be allowed to disclose.
Our members of public radio, aren't here today, but asked a question for Judge Edwards. They're watching Facebook Live. Their question for Judge Edwards are the precautions that the city's taking to safeguard our police, fire, and first responders.
Thank you very much. I first want to add my personal condolences to the victim's family with respect to this tragic death. As you well know, public safety is critically important in the city of St. Louis. We are still policing at the same levels that we have policed previously: our fire departments, our EMS, and our paramedics. Of course, we are working at the same level in our two correction facilities. It is important that we take very, very good care of public safety employees on the streets. Those are the folk that are having the encounters with strangers. So we have a sufficient amount of personal protective equipment at this time to ensure that both fire as well as our police are adequately protected. We still need more. There was a conversation that I had today with the state's Director of Public Safety, who assured me that additional PPEs or personal protective equipment will be provided to the city of St. Louis as soon as possible.
Now, what are the latest numbers for coronavirus cases in the city now?
At this present time, there are 20 confirmed cases, but we are continuing to receive updates from the state minute by minute.
Why not 20 is
Yes.
One final thing, and maybe I can get it very clearly. You said the latest victim who passed away was diagnosed yesterday with coronavirus. When did they pass away?
So we're not going to give that information out. If another entity decides to release that information, they can, but we will not.
Mayor, may I ask a question about the 6 o'clock, stay at home service? I was just driving around downtown today, and it's fairly emptied out, but you do see a lot of cars parked in front of some of the big corporations. And I wondered, how will this affect going forward? What would you tell the corporations they need to do going forward?
Well, what we've seen, and we've talked with many, is that they are also cutting down on the number of employees who come to work. Some of them have to, of course, continue to Ameren. They have to keep your electricity on. The internet companies have to keep your internet on. The gas companies got to keep the gas on. So there are a lot of larger companies that have to continue to keep some people, as few as possible, at work. And that's what all of them that I have talked to are doing. Maybe they're parking on the street because you don't have to pay parking meters. I don't know.
Mayor, do you think the licensed offices should be shut down throughout the city and the state? You see a lot of people going into those offices. There's not social distancing at all there. Do you think the governor should shut them down?
So you're talking about renewing your license plate or get your driver's license. So our office is shutting down. The governor has given everyone whose driver's license or plates expire in March or April an automatic 60-day extension. And that's why we are closing our license renewal office that's on the first floor. We were having many, many people last week come in, maybe they were off work or come in to renew their licenses. And so we were actually pretty instrumental in persuading the governor that that had to be shut down. We were the last remaining license office open in the city of St. Louis, so we were even getting more customers than usual. So that office is shut down.
The mayor or Dr. Nichols, could you address the lack of information given out about this death? Is there an effort to track down people that this person may have come in contact with? And why you can't give any more information? HIPAA or what is it, do we know what part of the city she lives in, the race, anything like that that could help us if people have the information that might be able to them?
So contact tracing is a part of our protocol. So our communicable disease staff, who are very knowledgeable and talented, are working really closely with individuals to obtain that information. And as it relates to the information that we are not able to provide, so we have to, as we mentioned in previous press conferences, we have to make sure we're adhering to the federal regulations that have been established as it relates to HIPAA and the release of protected health information.
One last question, since you're there before you, I asked you Saturday, just following up, since you heard that New York and California, the private orders using ships and the time to put the hospital ships in New York and then taking the facility and turning it into another hospital facility. Can you tell me about the negotiations for these sort of plans? Do we have plans on the shelf if the numbers really spike here? I know the efforts to start at 6 o'clock a day, so distancing, hopefully reduce the need for that, but do you have plans on the shelf if things are right now?
So the City of St. Louis Department of Health, as well as St. Louis County Department of Public Health, are working really closely with the health systems across the region. And so ensuring we have a coordinated effort is really important in the event that additional capacity is needed. So we're always planning to make sure we're 3 steps ahead of the situation. So we're hoping that individuals in the community will really take this seriously and comply with our recommendations. But we're monitoring the situation day by day. It's a rapidly evolving situation. So again, if there's a need for additional hospital capacity, we're planning alongside the health systems in the region.
All right, thanks, guys.
Can I ask Mayor, just one more guiding question? How long do you think this could last? How bad is it going to get? How are we going to get through this?
The order that was issued on Saturday is for 30 days until April 22nd, and that's a starting point. I don't know how long this will last. I'm, like you are, I'm listening to Dr. Fauci, and he's made many predictions here. I think what we have to do, though, is we have to stay home. We have to stop the social mixing and the opportunity for this contagious virus. And the 30 days was put in place because that's 2 incubation periods for the COVID-19 virus, 2 14-day periods of time. We will reevaluate this as we go along, and it wouldn't surprise me if we extended it, but hopefully we won't have to.
Thanks, guys.
Thank you. Thanks all.